Welcome to the Buckeye Health Plan Nursing Facilities Orientation. We've provided details about our plan to help you familiarize yourself with us. Our presentation today will cover an overview of Buckeye Health Plan and our products, care management, prior authorization, claims, and our website, buckeyehealthplan.com. Buckeye is a care coordination plan that since 2004 is contracted with the ODM to serve the Medicaid population as well as Medicare Advantage, MyCare Ohio, and Ambetter populations. We've included a timeline of our products below as well as a few highlights. On the left, you'll see our product map for the state of Ohio. Our Medicaid product is in all 88 counties of Ohio. The Medicare and Medicaid regions are noted with a diagonal fill pattern. The MyCare Ohio regions are outlined in black, and the Ambetter region is noted with stars. One of the core values at Buckeye Health Plan is local support. We achieve this by having 4 offices in the main regions of Ohio. More details on our 4 products with Buckeye. Our Medicaid product is contracted with the State of Ohio's Department of Job and Family Services. Our MyCare Ohio product is contracted with both Medicare and Medicaid to provide benefits to dual eligible members of both Medicare and Medicaid in one single program. Allwell is our Medicare product in which we are contracted with CMS, and Ambetter is our commercial product offered to consumers through the health insurance marketplace known as the Exchange. Buckeye Medicaid eligibility covers 2 different areas, the CFC and ABD. The State of Ohio's ODJFS determines the eligibility. Eligibility is effective from the first day of each month and continues for the full month. You can verify eligibility and benefits at buckeyehealth.com or contact provider services. Medicaid benefits covers all medically necessary Medicaid covered services. There are no copays or deductibles. There are care management benefit services, as well as a member services call center which operates from 7 a.m. to 7 p.m. Also, vision and dental is available. On our Medicaid product, skilled nursing placement and services require prior authorization. We've listed claim information as well as examples of costs included in the nursing facility per diem for your reference below. This is what our Medicaid member ID card looks like. For those of you who have been with us for a while, you know we used to have a separate card for CFC and ABD. Now that the state went through their expansion years ago, they don't make a differentiation between CFC and ABD anymore. It's all the same card. Please be sure to copy the front and the back of each card. Under the Allwell DSNP eligibility, it is for those who are age 65 or older. They can be under the age of 65 with certain disabilities. However, it includes individuals of all ages with end-stage renal disease. They must live in the service area, and eligibility is effective on the first day of the month. The DSNP covered services includes Part A hospital, Part B medical, and Part D prescription drugs. All services that Medicare considers medically necessary. There are transportation benefits available. Under the Medicare Advantage eligibility, individuals must qualify for Medicare Part A and B. Members must live in the service plan area, have no end-stage renal disease at the time of enrollment, and eligibility is effective the first day of each month. Please be sure to verify eligibility at buckeyehealthplan.com or by contacting our provider services. Under the Part A, it covers skilled nursing care in a skilled nursing facility under certain conditions for a limited time. We've listed examples of the costs included in the nursing facility per diem below for your reference. The following ID cards are for our 2 Allwell Medicare products. At the top, you'll notice the ID card for our Medicare Advantage HMO. At the bottom, you'll notice the HMO SNP is notated. This is for our Medicare DSNP product. Please be sure to copy the front and the back of each card. Those who are eligible for the MyCare product are individuals who are 18 years and older, members residing in a MyCare Ohio service area, individuals who are entitled to benefits under Part A and under Part B and D, and receive full Medicaid benefits. Adults with disabilities, persons 65 years and older, and persons with serious mental illness. Under the MyCare covered services, we've listed a few of the highlights towards the top. Now it's important to note under the MyCare waiver services, there are 5 waiver services a MyCare waiver member may be eligible for. Now, a MyCare member may not necessarily be eligible for MyCare waivers, so it's important to note they must be waiver eligible to receive those services. For our opt-in enrollees, they are full duals with Buckeye, meaning they have both Medicare and Medicaid benefits through Buckeye Health Plan. You will submit one claim to Buckeye and it will be adjudicated and cross over. It will generate 2 payments and you will receive 2 EOBs. This is what our opt-in full dual MyCare member ID card looks like. As you'll notice, the red Medicare RX, as well as at the top of the card, the MyCare Ohio logo. Please be sure to copy the front and the back of each card. Under the opt-out program, Medicaid is secondary coverage with Buckeye. The Medicare benefits are through another non-MyCare payer, including fee-for-service. The secondary claims will need to be submitted to Buckeye and they will be adjudicated as secondary payer. This is what the opt-out Medicaid member ID card looks like. As you'll notice, the red Medicare RX is missing. It still has the MyCare Ohio logo on the top right. However, if you notice on the back of the card at the top, it reads Buckeye Medicaid member only. Please be sure to copy the front and the back of each card. For the transition of care under our MyCare product, new services will be based on the member's care plan. The care coordinator will be in contact with both the member and the provider. Once the services are approved, prior authorization will be entered into the system by the care coordinator. The care coordinator will contact the service providers with the prior authorization number, confirming that service can now take place. For existing services that are currently in place for a member will remain for the life of the demonstration. If you have questions if a service is authorized for the member, contact the MyCare Care Coordination team at the phone number listed below. Nursing facility levels of care under a MyCare product. The skilled under a Medicare benefit is where a member may be able to receive skilled care in a skilled nursing facility under their Medicare benefit if their nursing and/or therapy needs are not met at a lower level of care. For intermediate under a Medicaid benefit, they are short-term stays, no longer than 2 to 4 weeks, where a member may receive skilled services. Intermediate care requires a specific reason and a plan for resolution that must be established in order to meet this level of care. Respite under the waiver benefit are out-of-home respite services delivered to an individual in an out-of-home setting in order to allow respite for caregivers normally providing care. Long-term care under the Medicaid benefit is where the member has no plans to discharge from the facility. For nursing facility authorizations under a MyCare product, the skilled nursing facility, Medicare, and Medicaid requires a prior authorization medical necessity review. Long-term care requires documentation to support the level of care. The level of care assessment must be completed by the care manager. The care manager has a conversation with the member or caregiver to ensure they're agreeable to long-term care, and our medical management team builds the authorization in our system for claims payment. For authorization questions, please contact Buckeye Health Plan Medical Management at the phone number listed below. Patient liability will be sourced from the 834 file that Buckeye receives from MITS. If you need to report that the amount of patient liability taken out incorrectly on a claim, please call Provider Services at the phone number listed below. The Transportation Quick Reference Guide information is listed below. Wheelchair services with Medicaid, the facility should call our transportation vendor, Access to Care, at the phone number listed below, and a 48-hour notice is required. For stretcher services for our opt-in members, there's 2 parts. The facility should contact the transportation provider to arrange the trip, and they should also then reach out and contact Buckeye MyCare Medical Management at the phone number listed below to obtain prior authorization. For stretcher services for opt-out members, the facility should contact the member's Medicare provider. Ambetter is our exchange product. The requirements and eligibility are dictated through Ohio's health insurance marketplace and are listed below. Eligibility, benefits, and cost shares can be verified in the following three ways: the Ambetter Secure Provider Portal, the 24/7 Interactive Voice Response System, or by contacting our provider services at the phone number listed below. Ambetter benefits include the essential health benefits and are the same with every plan, which means they will cover the minimum comprehensive benefits, such as those listed below. This is what a copy of the Ambetter ID card looks like. As you'll notice, it has our Raspberry Ambetter logo on the left. Please be sure to copy the front and the back of each card. Under Ambetter claim submission, the rendering taxonomy code must be present for the claim to adjudicate correctly. Also, if the claim contains CLIA certified or CLIA waived services, that respective CLIA number must be entered in box 23 of a paper claim form or in the appropriate loop for EDI claims. Our care management program is available to those under our Medicaid, Medicare, and MyCare products. They offer face-to-face visits at the point of care with expected outcomes including optimization of members' health, improved continuity of care coordination. Under our prior authorizations, they do differ between each program that Buckeye offers. You're encouraged to go out to our website at buckeyehealthplan.com, where we've listed our quick reference guides for the prior authorization requirements. Also, we have a pre-auth needed tool on our website as well for specific services and procedures. In claim submissions, Buckeye accepts the following three claim submission methods: electronic claim submission, the Buckeye Secure Provider Portal, and paper claims. We've listed our payer ID as well as our EDI partners. If you need more information regarding EDI, please contact the phone number or email listed in the bottom right of this slide. Buckeye is contracted with PaceBand Health for our ERA and EFT. For more information, please visit pacebandhealth.com or by contacting them directly at the phone number listed below. To request an adjustment for a claim, please call Buckeye Provider Services, access our website, or submit a written request using the Provider Adjustment Request form. For COB adjustments, please use the COB Dispute and Adjustment form and include a copy of the EOP. Please mail it to the following address located on your quick reference guides. The adjustment request forms can be found on our website at buckeyehealthplan.com under the For Providers tab. In the Resources section, you'll find the manuals, forms, and resources. An administrative claim appeal should be submitted in writing within 180 days of the adverse finding and clearly marking appeal on the letter. The letter should include why, as well as any supporting documentation such as medical records or chart notes that would be pertinent for the supporting request for reconsideration. In the event that a request for medical services is denied due to lack of medical necessity, a peer-to-peer review may be requested with a Buckeye medical director on the member's behalf. Now, the request must be received within 2 business days of the date of notification by contacting the Buckeye coordinator at the phone number listed below. On the right, you'll notice a screenshot of buckeyehealthplan.com. This is our general public website in which we house many different resources available to you through our provider resources section. Also on our website is our Secure Provider Portal. Registration is free and easy, and there are a number of different benefits available to you. The Secure Provider Portal allows you to check on member eligibility, verify claim status, review payment history, as well as submit online authorizations. You will need to show completion for today's presentation. Please return to the previous web page, Scroll down to the bottom. You'll be prompted with a drop-down box for the topic, as well as a place to fill in your group name and tax ID. Thank you.